Okay, guys, so very good evening. As I promised you that today I will come with the ICD-11 updates. So yesterday in YouTube discussion we discussed with the what is DSM-5 updates. I hope you enjoyed it, and in today's session we will discuss ICD-11 updates. So we have two important classifications in psychiatry, DSM and ICD. Currently we have both classifications. We have a new edition, ICD-11 and DSM-5, and both updates are very important because they are on target by the examiners in various PG entrance exams, including FMGE also. So in this I will request you that please come more and more with the queries. So if you have any queries, we will discuss that also. Simultaneously I will see your queries also. So if you have any, please message me and I will happy to answer it. In ICD-11 updates, the first we'll talk about schizophrenia and related disorders. So schizophrenia and other psychotic spectrum disorders, or schizophrenia and related disorders. What's update according to ICD-11? Number one, ICD-11 also, the subtypes have been removed. The subtypes have been removed. Paranoid, hebephrenic, catatonic, simple, undifferentiated. Previously we had a subtypes of schizophrenia. Now schizophrenia is schizophrenia. Subtypes have been removed. Number two, now we have a new update in ICD-11, that how we divide the course of illness. The course of illness in schizophrenia, according to or as per ICD-11, we have three types. Number one, schizophrenia first episode. Schizophrenia first episode. In this patient, how we define schizophrenia first episode? Patient having a schizophrenia, currently patient meets the diagnostic criteria of schizophrenia, but in past patient never had a episode. So currently patient is having a schizophrenia, meeting the diagnostic criteria of schizophrenia, but there is no past episode. We call it a schizophrenia first episode. Second, schizophrenia multiple episodes. In schizophrenia multiple episodes, how we define as per ICD-11, the patient currently meeting the criteria of schizophrenia. So currently patient meeting the criteria of schizophrenia, and in past patient had at least one episode. In past patient had at least one episode, and between the current and past episode, there is a significant remission. There is a significant remission of symptoms. Significant remission means In between, patient almost remain the symptom free, then we only can call it an episode. So currently patient meeting the diagnostic criteria of schizophrenia, and in past patient had at least one episode of schizophrenia, and between the current episode and the past episode there is a significant remission of symptom. The third course of illness as per ICD-11 is schizophrenia continuum. Schizophrenia continuous. Schizophrenia continuous. In schizophrenia continuous, guys, we have currently patient fulfill the criteria of schizophrenia. So patient fulfill the criteria, diagnostic criteria of schizophrenia for almost entire duration of illness. And this entire duration of illness means this duration should be more than 1 year. This duration should be more than 1 year. So this is the three courses of illness of schizophrenia we have as per ICD-11. Schizophrenia first episode, current episode of schizophrenia, no past episode, schizophrenia multiple episodes, current episode, and at least one past episode. Between current and past episode, significant remission of symptoms, and the third, schizophrenia continuous. So this is a basic difference between schizophrenia continuous and schizophrenia first episode, that in schizophrenia continuous, entire duration of illness, the duration we define more than 1 year. So there are these three important changes have been made in this schizophrenia, and two already I told you. Subtypes of schizophrenia have been removed and course of illness have been divided. The third important point about that we have the catatonia has been made a separate diagnostic category. So as per ICD-11, we have, before catatonia we were calling catonic schizophrenia, catonic depression. Now we have a separate category, diagnostic category of catatonia. These are three significant changes have been made in schizophrenia and related disorder. Okay guys, the second we will talk about mood disorders. In mood disorders, we have number one. In mood disorder, basically only one important change we have in bipolar disorder. In bipolar disorder, we have only two types of bipolar disorder as per ICD-11, type 1 and type 2 bipolar disorder. So bipolar disorder type 1 and type 2. Type 1 and type 2. Okay. Yesterday I told you in DSM we have premenstrual dysphoric disorder, disruptive mood dysregulation disorder. Changes have been made in DSM-5. In ICD-11 we have only two type of bipolar disorder now, type 1 and type 2 in a formal classification of mood disorder. Okay. Next we have changes in a neurotic, stress related and somatoform disorder. In this what changes have been made. Number one, we have one important olfactory reference syndrome. This is a new diagnostic category in ICD-11. As per this diagnostic criteria, how we fulfill this olfactory reference syndrome, patient has belief, patient has a preoccupation about one thought, about one belief, that he is emitting foul odor or breath. But in reality, this is not the case. Okay, so in olfactory reference syndrome, patient has a preoccupation about one belief that he or she is emitting foul odor or breath, but in actual this is not the case. Okay, and for that, patient repetitively check about it, that whether he or she is emitting foul odor or not. That's why olfactory reference syndrome, we in DSM-5 we have under umbrella of that obsessive compulsive and related disorder overall. Apart from that, the second one, the hoarding disorder have been made a separate diagnostic category, separate diagnosis. Separate diagnostic category. It is no more under obsessive compulsive disorder, hoarding disorder, which has a worse prognosis because exposure and response prevention therapy is not very useful in hoarding disorder. In this disorder, patient having a habit of collection of useless or discarded thing at home. Okay, apart from that, we have the another new diagnostic entity is body focused repetitive disorder. Body focused repetitive disorder. In this we have trichotillomania and excoriation. Trichotillomania, patient have a habit of hair pulling, and excoriation, skin picking. Excoriation, skin picking. Okay, apart from that, we have under this we have a one important heading of complex PTSD in ICD-11. Complex post-traumatic stress disorder. By definition, what is complex PTSD? Complex PTSD, if when the patient having a some series of events occur repetitively, which is really very severe, extremely threatening nature, like childhood sexual abuse, like in a case of the slavery. Okay, significant life threatening situation person face repetitively, and then he develops the complex PTSD. In complex PTSD, we have some specific symptoms. Person having a severe abnormalities of affect regulation. Severe abnormalities of affect regulation. Apart from that, person doesn't feel that he or she is unable to, having an inability to feel emotions. Inability to feel emotions. Okay, and person feel like worthless person. Feel detached from the family or the environment, having a guilt, feeling of guilt is there. So this is a PTSD. Complex PTSD term has been used in ICD-11. Okay, apart from that, in ICD-11 we have bodily distress disorder. This is the term we are using for somatoform disorder. So in DSM-5 we use new term for somatoform disorder is what? Somatic symptoms and related disorder, and in ICD we use bodily distress disorder. Bodily distress disorder. Apart from that, another important term we use in ICD-11 is body integrity dysphoria. Body integrity dysphoria. Person doesn't like some own non-disabled body part, and he is having a persistent desire to become physically disabled. Persistent desire to become physically disabled. Body integrity dysphoria. The person having a discomfort of our own non-disabled body part, and he or she is having a persistent desire to become a physically disabled. This is body integrity dysphoria. So body integrity dysphoria, bodily distress disorder for somatoform, complex PTSD. Apart from that, body focused repetitive disorder, hoarding disorder, and we have olfactory reference syndrome. These are many new important terms have been used under categories of neurotic, stress related, and somatoform disorders. Okay guys, apart from that, we have substance use disorder. In substance use disorder, substance use disorders or substance abuse, in this we have few important points. In diagnosis, what we have, number one, even we have a single episode of harmful use. So before we had a ICD-10, we had a harmful use, persistent use of substance despite physical or psychological harm. Now we had added one, that single episode of harmful use. In this person having a one episode of single episode of use of alcohol that damage the person's physical health, damage the person physical or mental health. Okay, mental health or the important line has been added here, that or resulted in behavior which leads to harm of harm to health of others. That's very important line has been added. So person used a single episode of use of alcohol which causes the physical or mental health harm. Apart from that, or resulting in a behavior which actually leading to harm to health of others. This line has been added in ICD-11. Okay, this has been added. This is a new line has been added in criteria of also harmful use criteria, that it causes the persistent use of, previously we had a definition, persistent use of substance despite physical or psychological harm. Now we have, along with physical and psychological harm, we have this resulting in a behavior leading to harm to health of others as well. So this also we have been added. Apart from that, we have added in the new terms in ICD-11 is gambling disorder. Gambling disorder. Also gaming disorder. So gambling disorder and gaming disorder. Gaming disorder. This, we have gaming, some gambling and gaming disorder, and like this gaming disorder, PUBG, etc. So gambling disorder and gaming disorder has been added in ICD-11. Okay, and harmful use, single episode of harmful use. Correct. Apart from that, we have personality disorder. In personality disorders, we have this various classification, that the personality disorder, like we have schizoid, paranoid, schizotypal, narcissistic, that all have been removed. In ICD-11 current classification of ICD, we have divided personality disorder has been divided as per severity of symptoms. As per severity of symptom. And how we divided it? Mild personality disorder, moderate personality disorder, and severe personality disorder. So mild, moderate personality disorder, and severe personality disorder. Okay, severe personality disorder. This is a very new important information. So previously we had a various subtypes of PD, the paranoid, schizoid, schizotypal, narcissistic, borderline, antisocial. Now we have all these categories have been removed. We have, as per severity of symptoms, we have newer classification of PD in ICD-11, and we divide them mild, moderate, and severe personality disorder. Okay. Apart from that, previously we were calling the organic mental disorder in ICD-10. Now we call them neurocognitive disorder as per ICD-11 classification, we call them neurocognitive disorder. Okay. Next we have child psychiatry. In child psychiatry, guys, we have new term of autistic, the autism spectrum disorder. So previously we were calling it a pervasive developmental disorder. Previously we were calling it a pervasive developmental disorders. Now we call it autism spectrum disorder. It's a very important one. So this like in yesterday I was talking about DSM-5, we dividing them autistic spectrum disorder as per severity of the symptom, not the in a continuum, not the subtype. So before we had a autism, Asperger syndrome, Rett syndrome, Heller syndrome. Now we have them as a autism spectrum disorder as per severity. Okay. And apart from that, like as I told you yesterday, in DSM-5 also the language and communication criteria has been removed. In ICD-11 also the language and communication disturbance criteria has been removed. This criteria has been removed. Like only we have two important criteria, that impairment in social interaction and stereotype behavior. These changes have been made in a ICD-11 in child psychiatry. In eating disorder, we have the new diagnosis is binge eating disorder. Binge eating disorder has been added. And number 2, in anorexia nervosa, anorexia nervosa, one criteria we have BMI, that less than 18.5. Before this BMI was less than 17.5. Now it's a 18.5 kg per meter square. Okay, so this is a very important in anorexia nervosa criteria. And apart from that, we brought a new diagnosis in eating disorder, one more. It's a avoidant restrictive food intake disorder. Avoidant restrictive food intake disorder. In this patient doesn't like, the patient take the insufficient amount of food. He or she takes, and either they don't like the smell of the food or they don't like the taste of the food, so they take the insufficient amount of food, but there is no disturbance in body image. In this there is no disturbance in a body image. In avoidant restrictive food intake disorder, patient takes the insufficient amount of food because of maybe he doesn't like the taste or the smell of the food, but there is no body image disturbance. No body image disturbance. Okay guys, so these are the important changes have been made in okay. Yes, yeah, gambling disorder comes in this. Disorder means somebody is asking Dr. Sunny, so whether you are you have a syndromal criteria, Sunny, and then whether it causes the social and occupational dysfunction, then it's a disorder. It's a disorder. Okay, so yeah, so Dr. Shekhar, hello. Dr. Avi, hello. I hope you guys enjoyed this session. Okay, so these are the updates in ICD-11. Okay, if we'll go through from the initial one in schizophrenia to the subtypes removed, course of illness first, multiple and continuous, the separate diagnostic entity, catatonia, mood disorder, bipolar type 1 and type 2. In neurotic and stress, we have olfactory reference syndrome, hoarding disorder, body focused repetitive disorder, complex PTSD, and we have a bodily discharge disorder, another name of somatoform disorder, and body integrity dysphoria. In substance use, we have a single episode of harmful use, and the harm to health of others also have been included. Okay, and the gambling disorder and gaming disorder has been included in substance use. Okay, and personality disorder, the various subtypes have been removed. We divide as per severity of the symptom, mild, moderate, and severe. The new name of organic mental disorder is a neurocognitive disorder. The new name of pervasive developmental disorder is a autistic spectrum disorder in child psychiatry. Language communication disturbance have been removed in eating disorder. Binge eating disorder and avoidant restrictive food intake disorder is a new diagnostic entity. Anorexia nervosa, BMI is now less than 18.5. Okay guys, so these were the these were the updates of ICD-11. Yesterday I have given updates of DSM-5. I hope whenever you require it, you just go through these sessions and you have in your room these updates. Okay guys, so I hope you enjoyed it. See and share with your friends also. Catch you soon in another session. Bye bye, good night, love you all, and study hard and remain healthy. Bye bye.